Hi, welcome to Time of Death. I'm Ris.
And I'm Dee.
And if you're new here, welcome. We're two nurses that love talking true crime. We like to focus on cases that have a heavy medical influence to them, or cases that feature a medical professional as a perpetrator or a victim.
Well said, Ris. Ris, we're going to keep it very bland tonight. No humor, no dialogue, no intro. So I'm going to talk like this for the rest of the night.
Okay, I'll get going. Let me get into it. Today, we're going to be talking about a case from almost 11 years ago. This case takes place at St. John's Hospital in Maplewood, Minnesota, and it involves workplace violence. On Sunday, November 2nd, 2014 at 2 a.m., night shift was in full swing, and several nurses and other healthcare personnel were working in and around the nurses' station. Unbeknownst to them, one of their patients, 68-year-old Charles Emmett Logan, Charles had actually been admitted 4 days prior for confusion, paranoia, and delusions. And this night, around 2 a.m., he had removed a 3-foot-long metal bar from his bed. And he got dressed up in a jacket, had his boots on, ready to go. And the video surveillance shows him barging through the nurse's station, and he's yielding this metal bar, and he's swinging it at the healthcare workers sitting at the nurse's station. You see, I think 4 or 5 nurses just sitting there, or I don't know, their staff sitting there, and he just barges right into the nurse's station. All these nurses start scrambling to get away. He's trying to hurt them. So chaos ensues, and staff are scrambling away to get away from him. One of the nurses swipes her badge on a set of double doors nearby the nurse's station, and they run for it. So it must have been a locked unit. So they swipe the badge to open it, and 3 of them get through the door, and then a 5th and 4th nurse are caught at the door. And this man is running right at them, and he's holding the metal bar above his head. Oh my God. And the 3rd nurse that had gone through held the door open for the other 2 nurses so that they could get through.
Good.
But they're able to pass through, but so can the man. And he follows the nurses, and he's running after them, and he hits several of the nurses with the bar.
With the bar, it was iron, you said?
It was a metal bar. And he just follows them. He's running after them, hitting them. And on the footage, it was really sad. It looks like the 4th nurse that passed through, looks back and reaches out for the 5th nurse to, push her forward. But he gets to both of them. And one of them we see end up on the ground.
Oh, my God.
And it just was very scary to watch. And then it pans into the inside of the unit, and one of the nurses who had gone the opposite way from the doors when he had come through, runs right to where the phone is to try to call for help. And you also see this man inside the unit running towards the door, and he's wearing a t-shirt. He's actually a patient.
Yep, trying to AWOL.
No, not trying to AWOL. He's trying to help.
Wow.
So Adam Lynn, he was another patient who was hospitalized after he had an appendectomy. So he had his appendix out.
Wait, so this is not a locked psych unit?
No.
What kind of unit is this?
I don't know what kind of unit. I couldn't see a specific kind, but I think probably a med-surg unit.
Wow.
And he was sleeping nearby the nurse's station when he heard screaming. Adam recalls a lot of screaming from the women. And he said, "I took a look out my door, and then I ran like hell." And he found blood everywhere, and several nurses were laying in the hallway being beaten up by this man. He actually worked as a security guard, so he was just ready to defend the staff. That's why he ran. And if you watch the footage, he runs to the now closed double doors that the nurses and the man had run through. And he just is running right to the door, and the door had been closing. It was just about to close when he started running towards it. And so he misses it, and he tries to open it, and of course it won't open. And he said it was probably the hardest thing to know that the man was right there and that he was stuck inside. And that's where the footage ends, but A nurse actually locks the door for Adam, and Adam flies out the double doors after Charles. And Charles makes it out of the building, and police are tracking him. They track him 3 blocks from the hospital, and they confront Charles. And he wasn't letting go of the metal bar, and he ended up actually charging at police. Police ended up tasing him, but the probes on the taser didn't connect with him, and no electrical current was delivered at the time. So they end up tackling him after this, and they put him in handcuffs, and he actually goes limp. And he's not breathing. Police are unable to palpate a pulse, so they start CPR. And they organize transport back to the hospital.
Back to the hospital where he assaulted these nurses.
Yeah, so he went back to the same hospital. And he was pronounced dead there. Several officers were placed on administrative leave in response while the autopsy was conducted. And I saw in 4 nurses, another place I saw 8 nurses. So we're just going to go with 8 nurses were wounded as a result. And thankfully none died.
Oh my God.
But one suffered a collapsed lung, another sustained a broken wrist, and others had cuts or bruises. 2 nurses were hospitalized due to their injuries. One of the nurses, she wasn't hospitalized, but she was 8 months pregnant.
Did she lose the baby?
I don't know. I hope not. We're not going to discuss any of the names of the victims to protect their privacy. When Adam was discharged from the unit, nurses and staff lined the hallways to clap as he left. Let's talk about Charles. Charles was a mechanic for Metro Transit. He, like we said, had been admitted for confusion and delusions a few days prior. Right before the attack, apparently, Charles had been arguing with some members of his family. And people that knew him said that he was like a salt of the earth kind of guy. They said it was out of character for him to behave this way. I couldn't find any history of violence during previous visits or during his current hospitalization anywhere online. And he also had no previous arrests. Investigation ensued, and the autopsy ruled that Charles' death was possibly due to like an excited delirium. And investigators found notes on his whiteboard in the room that indicated that he was having issues with his prescribed meds. He had written, "When people fear you, they control you. I fear no one." Another note said, "All the medicine you can buy, all the doctors you can hire, you are going to take sick and die." After poring over the surveillance footage and the injuries of the nurses, investigators concluded that Charles intended to cause grave harm or death to the nurses. Police believe that Charles may have been experiencing a delusion that he needed to fight his way out of the hospital.
It's, at that point, I think that recognizing that there are precursors when he's writing things down that are threats to staff about doctors and control and killing, those are red flags that need to be addressed seriously. Like, they need to be taken as a potential, as threats, right?
Yeah.
And with early intervention and addressing the issue, maybe taking extra safety precautions. And I realize this is like something that happens all the time in hospitals, and sometimes the patients don't end up assaulting staff, but there are signs, there are warnings that I think need to be taken very seriously.
Something that stuck out with me was just like the nurses just doing what they had to do, them reaching out for each other to like push them, keep the door open, even though the safest thing for you is to let it go and run. It was, I'll show you the video after, but it was really scary to see too, because we're in that position every day. Like, how easy would it be for anything like that to happen?
Well, at my job, I'm on the workplace violence committee, and it happens so frequently. And, it's there should be absolutely no tolerance. And, I'm so glad that someone intervened, but there are some like severely lacking safety precautions in the hospital settings, and keeping staff safe is critical. There's such a focus on patient safety, but what about staff safety?
Exactly.
So it's so disheartening to hear. And why was he able to grab a steel bar? Where did he get that from?
It was, I guess, attached to his bed. I don't really know.
There needs to be safety minded with equipment as well, and you never know. And I hope that the family of this gentleman did get some. But it sounds like there was almost something medical going on with him potentially, because for someone to just snap like that is very bizarre.
Yeah, from what I've read, it was very out of character for him. So something must have prompted him to have this behavioral change. Let's talk about a little bit about workplace violence in the healthcare setting. So we've covered similar cases before, but workplace violence is directly connected to decreased job satisfaction, feelings of burnout, feelings of guilt, humiliation, emotional stress, staff turnover, violence being the reason often for nurses to leave a job altogether. Between 8 to 38% of nurses report having suffered from violence at one point or another in their healthcare career.
How many?
8 to 38%. Another statistic shows that 1 out of 5 nurses will experience workplace violence. Based on a study from 2022, greater than 70% of nurses are constantly worried about becoming a victim in the workplace setting, which is just crazy to me. 70% are fearful that something's going to happen.
Totally unacceptable.
That is unacceptable. And the healthcare workers have a higher risk of becoming physically, sexually, or psychologically injured than other areas of work.
Well, when you think about it, it's a woman-dominated field. Hospitals actively are discouraging nurses and different staff members to file police reports, even report the assaults if they do happen. So it's a vicious cycle, and it's toxic, and, it's going to take a lot of time before, safety of the staff members are a priority.
So that's exactly right. And I'm glad you brought up that it's still like a female-dominated profession, because that does play a role. Based off of a study conducted in Iran, 90% of workplace violence victims were female. And also, like you pointed out, often workplace violence is dismissed, or it's downplayed, or it's expected to be part of the job. And sometimes healthcare workers just think it's normal, but it's not normal. And that's why it's so important to talk about it, so that we can help prevent it from happening and to get help when it is happening. Units that workplace violence is especially high on include elderly units, pediatric units, maternity, psych units, and emergency departments. Patients who are dealing with dementia, or those that are psychotic or under the influence of drugs or alcohol, or those that are just anxious, can be more likely to be offenders of workplace violence. But there are patients or people that are in a hospital, such as visitors, who can be completely alert and oriented and behaving appropriately, that can also harm nurses or other healthcare staff. So anyone can. People who are completely with it are at risk for hurting us as well. So, but just because someone does have like dementia or mental illness, I'm not saying, that's not the point I'm trying to make, that they're more at risk, but it just is a factor.
I had a patient choke me with my stethoscope as a brand new nurse.
Wow.
And it was around my neck, and after that, I never wore my stethoscope around my neck again.
But it's like PTSD, because how are you supposed to just move on from that? Like, never happened? There actually is an assessment denoted by the acronym STAMPEDAR, which means staring, tone or volume of voice, assertiveness, mumbling, pacing, emotions, disease process, anxiety, and resources. And this is a tool that can be helpful in seeing whether or not someone is at a higher risk of becoming violent. STAMPEDAR, Stampeder.
Stampeder. I'm going to look into that.
Yeah. And then another one is DASA, DASA, Dynamic Appraisal of Situational Aggression. And this screens patients on 7 different behaviors. And if they have greater than 3 behaviors, they are considered high risk for becoming aggressive.
I'm not familiar with those.
Brosset score is another one that we use.
I call it Brosset.
What is it, Brosset?
Brosset.
I don't know how to pronounce it.
I don't either. I just said Brosset, but Brosset sounds more professional. Brosset.
In the workplace, verbal abuse is the most common form of non-physical abuse, followed by then threats and also sexual harassment. In regards to physical abuse, nurses are kicked, bitten, slapped, pinched, pushed, or even stabbed or shot at. Regardless, when there's any kind of abuse, psychological effects occur as a result. Nurses can develop increased job stress, decreased satisfaction with their job, burnout, increased call-outs, sleeping issues, fatigue, PTSD, and increased fear, and in some cases, suicide.
Mm-hmm.
I understand that when people are hospitalized and have a lot going on physically and mentally, in some cases it can be very overwhelming, it's frustrating and stressful, but it's never, workplace violence is never appropriate. Healthcare staff are there to help care for people and protect them, and it's very ironic that as a result they can be put in such dangerous situations. Mm-hmm. Causes of workplace violence include understaffing, increased stress among healthcare workers, an intense role, and prolonged waiting periods. An interesting statistic I found was that 63% of reported emergency department violence occurred in the waiting room. Because people, when they gotta wait, sometimes, that can be a factor. Mm-hmm. So not only do we need to change attitudes and expected behavior of patients and visitors, but we also have to change things at the administrative level as well. As nurses, it's important to be knowledgeable about what constitutes as workplace violence and how to protect yourself as much as you can, as well as understanding what is and what is not appropriate. Bottom line is violence is not a part of what we signed up for, and it's very important that we change the narrative in that regard.
Well said. I absolutely agree.
Unfortunately, the incidence of workplace violence is not improving. The new year started with an attack on an ER nurse in North Carolina by a patient, and that patient has been charged with assault. In North Carolina, there was actually a law that passed just a few months prior that a police officer must be stationed in hospital emergency departments, and luckily the public safety officer was able to respond very quickly.
Thank God.
In 2025, the governor of Ohio signed the Healthcare Workplace Safety Act, which requires hospitals to have a workplace prevention security plan and also have a way to report incidents of violence. OSHA was set to propose a new ruling in December related to workplace violence that would include the development and implementation of a written workplace violence prevention program, the implementation of controls to offset identified hazards, the performance of hazard assessments, training for staff, and maintaining a workplace violence record log, as well as teaching employees of their rights. This needs to be a top priority in the healthcare universe and in general in society.
Beautifully said. Great, absolutely wonderful, thorough case. And I think it's so appropriate to talk about the fact that when people, are abusing nurses, whether it's physically, emotionally, sexually, it's totally inappropriate.
Thank you all for listening today. We do appreciate you listening every week. And if there's any suggestions you have, we'd love to hear them. Or any cases that you find interesting that you'd like us to cover, we'd love to get your feedback. And if you did enjoy our podcast, feel free to leave us a good review or review us. Let us know what you think. And with that being said, let's call it. The time is 20:58. That is 8:58 p.m. for those of you who do not use military time. And we are checking out. Bye.
Bye.